Well, I'm very honored to be able to introduce to those few of you who might not be familiar with the magnitude and really extraordinary service of Dr. Dean Ornish. I've been blessed myself to work with him almost 20 years now, and I am continually learning from his creativity and his contribution to the medical benefits of yoga. He is a graduate of the Baylor College of Medicine, also did his residency at Harvard and the Massachusetts General Hospital, so this gives him extraordinary credentials in medicine, Western medicine. Those of you who may have seen him, he's been featured on Nova, an hour-long program, and as part of the Bill Moyer special. And you have a treat upcoming because on July 15th, he'll be on the Oprah Winfrey Show for an hour. It's the entire show focused on his work, just one person, and so that's a real honor in itself. Something Sri Gurudev doesn't even know, but recently he won the University of Texas Outstanding Alumni Award for 1994. He is president and founder and director of the Preventive Medicine Research Institute in San Francisco. And he is also on the faculty of the University of California School of Medicine. He is really single-handedly transforming American medicine for all of our benefit. And it's really indeed a big honor to have him here with us. He is also the personal physician of President Clinton. And he has just come from 2 days in the White House, where he's been teaching his methods and recipes to the staff there at the Clintons' request. He's helping them to design the new health care plan and educating them along the lines of yoga, teaching them yoga classes personally. So we're really, indeed, honored to have him here.
If I use this lavalier, can you all hear okay? Excuse me. Well, thank you for your overly kind introduction. I appreciate it. And it's really not fair to say that that Amrita has worked with me, because she was really one of my first teachers when I was a medical student back in 1975, a long time ago, almost 20 years ago. She had the country's first, we didn't even call it a holistic health clinic. They didn't use that word then, I guess, integrated health center. Probably the first in the country, and I came and studied with her, and she was really a real inspiration and still is for me. So I just want to acknowledge that. And and it was not so long after that when I was giving a talk at the ashram in Connecticut in Pomfret Center. After the lecture, Mira Alexander's husband, Lester Sukarta, came up to me and said, "You know, you ought to write a book." I said, "Yeah, right, you know." He said, "No, I mean it." He says, "I work as a literary agent and I can help you do it." I said, "Yeah, right, you know." So we went to New York together, and sure enough, that's how the first book came to be. So you just never know what may come out of lectures like this. So when they asked me to stay over, I said, "Well, you never know. Maybe I should." So, but really, all of the work that I've been doing is just what I've learned from Sri Swami Satchidananda in different forms. And so what I want to share with you tonight is a series of studies that Amrita and I and our colleagues have been doing over the last 17 or 18 years, focused on the area of heart disease, because I think it's useful to start with one area and show how powerful it can be as an example for showing how effective it can be in other areas. Heart disease is a good example, I think, because more people die of heart and blood vessel diseases each year in this country than virtually everything else combined, including all forms of cancer and AIDS and infectious diseases and accidents and you name it. And yet what we're learning is that on the one hand, even though it kills more people than just about everything else combined, it's virtually preventable for probably 95 to 98% of people if we were just willing to put into practice what we already know. So we don't have to wait for a new drug, a new surgical technique, something high tech. We just simply need to put into practice what we already know. And I see over there Rudra Leffer, who's one of the participants, I should say. He's not even a patient anymore in our study. Does everyone know you? Can you stand up for a second? And if it weren't for people, I mean, I can do anything, but if the people don't follow the program, then it's for nothing. And it's because of Rudra's dedication and those who have been with him in the program that we've been able to show what we're showing. And that's no small feat to be able to do something like that. So I just want to acknowledge what you and your colleagues have been doing. What I'd like to do today is to go through a series of slides that I have. If I can just go ahead and, whoa, Vidyananda warned me, don't go in front of the speakers. In a way, that's kind of like what pain's function is to warn you, is to remind you that you're not supposed to do certain things. And that's one of the things that I've learned from Swamiji, which is that it's there for a reason. You know, he's often talked about the pain is your friend. It's there, you shouldn't seek it out, shouldn't be a masochist, but it's there to teach you that you're doing something that's not in your best interest. And if we can listen to it instead of trying to kill the pain or bypass the pain, if we could have the first slide, really, in a sense, everything that we'll be talking about can be summarized in this cartoon here. You can turn the lights off, but don't meditate too deeply with the lights off. That is, and this again is just what I've learned from Sri Swamiji, which is that if you don't deal with the underlying cause of the problem, if you literally, that's good, not too dark, that's good. The stars have come out, I can see. If you, this reminds me of San Francisco in the early 70s. It's kind of exciting. You never know what's going to happen at the ashram. That's one of the nice things about it. Anyway, the idea is that if you don't deal with the underlying cause of a problem, this is something that Swamiji used to say to me over and over again. I wasn't really a very good student, and he'd, kind of have to hammer it in sometimes. He'd say, well, what is the cause? And what is the cause of that? And what is the cause of that? And, keep going farther back. And the idea is that the farther back in the chain of events you go, the more powerful the healing can be. But if you don't go very far back, if you just literally or figuratively bypass it, literally with bypass surgery, even the name itself tells you the problem. It's just bypassing the problem. You're not addressing the underlying cause. If you just bypass a problem and you don't also deal with the cause, then more often than not, the same problem comes back again. Or you get a whole new set of problems or side effects that you hadn't counted on. Or you're faced with painful choices. And that's as true on a health policy or a social level as it is on an individual level. It's as true for just about anything as it is for heart disease. We know now, for example, that within 5 years, half of the bypasses have clogged up. And within 7 to 10 years, 80% have clogged up. Last year, more money was spent on bypass surgery than for any other operation in this country, over $18 billion. Angioplasty is the same problem. If you blow up a balloon inside an artery that's blocked, within 4 to 6 months, somewhere between a third and half of them have clogged up again. And we spent about $6 billion last year in this country on that one procedure. It doesn't matter what you do, if you do it with a balloon, or you do it with a laser, or you do it with an atherectomy, or you do it with a rotablator, or you do it with a roto-rooter, it's still the same problem. But if we can deal with the underlying causes, in this case of heart disease, what we eat, how we respond to stress, how much exercise we get, whether or not we smoke, the quality of our relationships with other people, then we find that your body has a much greater capacity to begin healing itself than we had once thought, and much more quickly than we had once thought. Within a few days, if people make these changes, their chest pain tends to go away very quickly. Within a month, we've measured the blood flow to the heart can improve. And the heart begins to pump blood more normally. Within a year, we find that even severely blocked arteries can become measurably less blocked. And the most recent findings, which we presented last November at the American Heart Association's national meeting in Atlanta, is that after 4 years, there was even more reversal than after 1 year. And a few of our patients have gone on to have tests at 6 years and even 8 years, and we're finding there's even more reversal after 6 years or 8 years than after 4 years. And I'll show you some pictures of that in a few minutes. So instead of getting worse and worse over time, which is what usually happens when someone is told they have heart disease, they're told you're going to just get worse. It's just a question of how quickly you're going to get worse. But instead of getting worse and worse, we're finding that many people can get better and better. And these findings are giving many people new hope and new choices that they didn't have before. And for me, there's nothing more rewarding than to work with people who've, basically been told they're going to get their affairs in order, they're going to die, and they're just going to have to live with this pain for the rest of their life. And to say, no, that's really not the case. You have other choices. And then through their example, and that's part of the value of doing research, is that to demonstrate to other people that they also have that choice and that they too can get better. It's like until Roger Bannister broke the 4-minute mile, everybody thought it was impossible. Once one person did it, then suddenly it became fairly routine. And it's the same here. Before, people thought once you had heart disease, it was impossible to reverse it. But now that we know that it can be done through the examples of people like Rudra and others, then we know that other people can do that too. That gives people that sense of what's possible. For me, I had the fortune of having someone like Swami Satchidananda in my life to be a teacher. And so I'd go to him, I'd say, well, what do you think? I'd like to do this study. You think it'll work? He said, I know it'll work. So it's like, to me, it's like, well, okay, then I don't have to worry, It's like in algebra, in my textbook, they had a little answer book in the back. You get the answer, then it's easy to figure out how to do it. So that gave me the confidence. Now, I didn't know until later that he wasn't sure. He just told me that. But it didn't matter, because I believed it would work. And so all these obstacles came up, and I thought to myself, well, they just don't know. It's going to work, so we don't have to worry about it. I had that kind of confidence. It's like the story he used to tell. I'm sure you've heard it about the teacher who tells his student, oh, yes, you can walk across the water. And they walk across the water, and the teacher does it, and he drowns because he didn't really believe it. But he was so sure that the students could do that. That's not the case here, but with that kind of confidence, it really helps. And there were so many obstacles. We couldn't get funding to do the work. Everybody said, this is a crazy idea. Nobody can reverse heart disease. And I said, well, to myself, I know it can be done. Swamiji said it can be done, it can be done. And then they wouldn't give us any money to do it. They said, why should we fund this crazy idea? And besides, even if heart disease could be reversed, nobody would do it. Because you have an untestable theory. You have all these sophisticated tests. You've got quantitative coronary arteriograms and exercise radionuclide ventriculograms and cardiac positron emission tomography and all these things, exercise thallium scintigraphy. But if no one follows your program, nobody can do it. It's an untestable theory. Why should we waste our money funding it? And I said, well, let's find out. Even if we show people can't do it, that'll be interesting. They said, but no one can do it, so why should we waste our money? So I ended up having to go to different people in Texas, where I grew up, and people like Gerald Hines and Gennard Gross, and people who are oil company executives and real estate developers and banks and airline people. And all these people I never thought I'd have a whole lot to do with suddenly became the benefactors for our work. And it was through their belief and their vision that we were able to do this. Finally, after, 12 years of doing this, then the National Institutes of Health finally said, okay, you showed it after 1 year, we'll give you a grant to do it for 3 more years to see what happens. But so often you're in a catch-22. They won't give you the money to do it because they say it's impossible, and without the money you can't do the research to show that it is possible. And then they say, well, see, it's impossible. It's a good thing we didn't fund it. So anyway, that's now changing. And I'm saying all this just to tell you what a debt that I feel to Swamiji, not only for teaching me these things in my own life and also for giving us what amounts to most of what we're doing in our research, but equally important for giving me that sense of confidence of what was possible. So the program is basically integral yoga, as you all recognize. We learned a long time ago in Texas in 1977. I was a medical student. I had the good fortune to be on Dr. Michael Tabaki's surgical service, learning how to do bypass surgery. And we'd cut people open and we'd bypass the blocked arteries. The chest pain would go away. They'd think they were cured, and then they would go home and eat the same food and not manage stress well and not exercise and continue to smoke. And as I mentioned, more often than not, the bypasses would clog up. And so we'd cut them open again and bypass the bypass, sometimes 2 or 3 times. And we'd gotten to a point in medicine where it was considered conservative to cut someone's chest open and bypass their arteries. or even the latest techniques of cutting open your abdomen and bypassing your intestinal tract, a technique called partial ileal bypass surgery. It's like an intestinal bypass where you shorten your intestinal tract so you don't absorb your food as a way of lowering your cholesterol. The more conservative approach, and that it was somehow radical to ask people to stop smoking, eat vegetables, meditate, and walk. You know. but that's changing. That's changing. And we also learned that when you're trying to build bridges among different worlds, that the language becomes important, the terminology becomes important. And one of the things, the lessons, and there's so many things I've learned from Swamiji, but one of them is that, you know, when in Rome, you know, speak as the Romans do. So the first study when I was a medical student, I decided I'd take a year off between my second and third years of medical school, much to my parents' dismay. And said, let's do a study called The Effects of Yoga and a Vegetarian Diet on Heart Disease. And this very nice cardiologist kind of put his arm around me one day and he said, you know, I'd like to refer patients to you, but I can't if you call it that. What am I going to tell my patients? We're referring them to the Swami? And I said, well, what do you think? So he said, instead of calling it The Effects of Yoga and a Vegetarian Diet, why don't you call it The Effects of Stress Management Training and a Low-Fat Diet? And I said, okay. So, you know, it's all the same. It didn't matter. So if you're trying to build bridges, those words, you know, push people's buttons sometimes. Now things are different. We just call it what it is. But during that time, we learned, so we called it a low-fat diet. We'd even call it vegetarian. Stress management training, i.e. yoga, smoking cessation, moderate exercise, and group support. Let me go through the first part. Let's start with the diet, and let's look at the medical and scientific literature first. And you see that it says 7-Up flushes out cholesterol. It says, medical research confirms, it must be true. It says so in the paper. And then it says, 1 can a day adds years to your life. And you've been drinking ginger ale all this time, you know? I don't know. And then there's the Dolly Parton fried chicken diet. We'll talk more about that in a little later. But you know, a lot of people get their health information from reading newspapers, whether the New York Times or the National Examiner, and they get confused. They say, you know, one day the doctors say margarine's better for you than butter, and then they say it's not so good, and maybe olive oil's better, maybe it's worse. You know, to hell with them. Bring out the bacon and eggs. We can't figure it out. But if you look at all of the data, it actually says pretty much the same thing, if you look at it all in aggregate. And one of the things about the media is they always like controversy above truth. In fact, one time they wanted me to be on the Donahue Show, on a show on alternative medicine. There was a film called Leap of Faith that came out a few years ago, and I was a consultant on it. They wanted me to be on the show, and they wanted me to say that chemotherapy and surgery and conventional medicine are terrible, and you should always, if you have cancer, you should use herbs and meditate. And I said, well, you know, herbs and meditation can be helpful, but so can all these other things. They said, well, we don't want you to say that. I said, well, that's not true. Well, we don't care what's true. We just want controversy, you know. So anyway. But if you look at all the literature, a meat-based diet is not very helpful when compared to a plant-based diet. Plant-based diet is another way of saying vegetarian, but it doesn't push people's buttons quite the same way. Cholesterol is only found in animal products, which also tend to be high in both total fat and saturated fat, which your body converts to cholesterol. Whereas there's no cholesterol in plant foods, none at all. And with few exceptions, tend to be low in both total fat and saturated fat. Meat is high in iron, which oxidizes cholesterol to a form that makes it more dangerous. It's more likely to be taken into your arterial wall. That's very low in a plant-based diet. In fact, one of the reasons why premenopausal women may have less heart disease than men is because when they menstruate every month, they lose the iron in the blood. And so the iron, you know, you shouldn't even be taking iron in vitamins unless you have a real iron deficiency anemia. Whereas instead of being low in oxidants, a plant-based diet is high in the antioxidants, beta-carotene, vitamin A, vitamin C, vitamin E, that help to prevent that. They also help to prevent the formation of what are called free radicals, which are not Jane Fonda in her earlier days, but have to do with substances that can promote aging and cause cancer. And the final thing is that there's no fiber in meat, which is high in a plant-based diet. If you look at other parts of the world, you find in China, for example, can you see these slides? Is the light too bright? Or so, is that better? Yeah. That in China, they have a fraction of the, well, just leave it like that, it's fine. In China, they have a fraction of the heart disease that you find in this country. It's not even close. I don't have a pointer here. I'll just use the old-fashioned pointer, this one. You can see here, and yet when those same Chinese moved from China to the US, oh, thank you so much. I feel like a professor. Or a drill team leader, I'm not sure which. When the Chinese move from China to the US, they go from this to this. They go from one of the lowest to one of the highest rates of heart disease in the world. And so it's not a genetic difference, it's a lifestyle difference. What's discouraging is that in many countries, like Japan, where I was lecturing about 2 years ago, in Japan, the average cholesterol in boys aged 10 to 12 in Japan is now not only as high, it's 75% higher than American boys aged 10 to 12. What that means is in one generation, they're going to go from this to this. And it's so preventable. It's so much easier to prevent disease than to try to reverse it. And it's not just heart disease. Colon cancer is a fraction of what you find in this country. So is prostate cancer in men, and lung and ovarian cancers, breast cancer in women, osteoporosis, diabetes, hypertension, obesity. A wide range of what are called degenerative diseases are directly linked to the intake of animal products, especially red meat. If you look at vegetarians in this country, Seventh-day Adventists have 3 times less fatal coronary heart disease than non-vegetarians. Many years ago, Dr. Frank Sachs, who's at Harvard now, and we actually drew blood at the ashram in Connecticut, at the Satchidananda ashram in Connecticut. We looked at all the cholesterol levels. We found they were much lower than people in the general public of the same age. So the diet that I think is optimal, certainly for reversing heart disease, is much lower in fat than most people eat. It's about 10% fat. The average American eats about 40% fat. The American Heart Association recommends 30% fat. Now the problem, a 30% fat diet means less red meat, more fish and chicken, take the skin off the chicken, 4 eggs a week, and so on. The problem with a 30% fat diet, it doesn't work. You know, it just doesn't work. Studies have shown your cholesterol level comes down by only about 5%. In fact, one study came out a year ago, and they said, why even bother? Just put everyone on drugs. Diet doesn't work. In our study, cholesterol levels came down by 40% on average. Many people came down even more than that. It also means if you lose weight, you gain it back. It means, worst of all, if you have heart disease, that your heart disease gets worse over time. And in every study that's come out, and there are over a dozen, if you have heart disease and you only go on the 30% fat diet, in every one of those studies, you get worse. Okay?
Why are you doing all that constantly?
I think they want to be able to video the thing. Okay, why don't you turn it off in between each slide? That would probably be good. So in every one of those studies, you get worse. Now, I've been in public debates with the president of the American Heart Association, and I have great respect for the Heart Association. They do wonderful work, but in this particular area, I think they're wrong. Because if every study that comes out shows that when people who have heart disease follow a 30% fat diet and they get worse, then they should do something different. And they say, well, no one will change their diet more than that, so we won't even tell them. Which to me is somewhat like telling people who smoke, well, we know you won't quit smoking, it's too hard, so just cut back from 3 packs a day to 2 packs a day, because it's too hard to quit. Well, it is hard to quit smoking. In fact, nicotine is as addictive as cocaine or crack in most studies. But we don't tell people that. We say, yes, it's hard, and a lot of the damage to your heart and lungs is reversible, but only if you quit. Cutting back won't do it. And what I believe is giving people the facts that they can use to make informed choices. And Swamiji and I were talking about this earlier today. He said, you know, you don't have to try to change anybody. Just give them the information, and then they can do with it whatever they want. We'll talk more about that in a minute. We even know why that is. The Nobel Prize in Medicine a few years ago went to the doctors who discovered what's called the cholesterol receptor. The cholesterol receptor binds and removes cholesterol from your blood. The more receptors you have, the more